How do I protect myself? 1. Wash your hands regularly. Regularly treat your hands with alcohol-containing products or wash them with soap. If a virus is present on the surface of the hands, then treating the hands with alcohol-containing agent or washing them with soap will kill it. 2. Keep your distance in public places. Keep at least 1 meter away from people, especially if they have a cough, runny nose, and fever. Coughing or sneezing, a person with a respiratory infection spreads the smallest drops containing the virus around them. If you are too close to such a person, you can get the virus when you inhale air. 3. Do not touch your eyes, nose, or mouth with your hands. Hands touch many surfaces where the virus may be present. By touching the infected hands to the eyes, nose, or mouth, you can transfer the virus from the skin of the hands to the body. 4. Follow the rules of respiratory hygiene. When coughing and sneezing, cover your mouth and nose with a napkin or the crook of your elbow. Immediately throw the napkin into a trash container with a lid and treat your hands with an alcohol-containing antiseptic or wash them with soap and water. Covering your mouth and nose when coughing and sneezing helps prevent the spread of viruses and other pathogens. If you cover your nose and mouth with your hand when coughing or sneezing, germs can get on your hands and then on objects or people you touch. 5. If you have a fever, cough, or difficulty breathing, seek medical attention as soon as possible. If you have visited areas of China where 2019 Gov is registered, or have had close contact with someone who has symptoms of respiratory illness after traveling from China, please inform a healthcare professional. Fever, coughing, and breathing difficulties require immediate medical attention, as they may be caused by a respiratory infection or other serious illness. Symptoms of respiratory damage in combination with an increase in temperature can have a variety of causes, among which, depending on the trips made by the patient and his contacts, may be 2019 Gov. 6. When possible, avoid large crowds. Especially take care of your older relatives. Send your grandparents to their dacha, protect them from going to clinics, pharmacies, and stores. 7. Monitor the humidity of the room. Normally, 40 to 80%, moist mucosa equals protected mucosa. 8. Drink more liquid. Dehydration also leads to dryness of the mucous membranes. 9. Do not travel to countries with a high risk of an epidemic. 10. If you are in a serious condition and have shortness of breath, call a doctor immediately. 11. Stock up on medications that you take constantly for blood pressure, diabetes, asthma, antipyretics, and so on, to minimize trips to the pharmacy and protect yourself in case of quarantine. What is the forecast? There is evidence that the virus is unstable in ultraviolet light. This gives hope that with the advent of heat, the epidemic will go down. But at the same time, this disease is likely to become an annual epidemic, like the flu. At the same time, there will be a vaccine and medicines, and it will become less dangerous. In the meantime, take precautions. Take care of yourself and your loved ones. Conclusions. Yes, there is a new virus that man received from animals. It is more complicated than ARVI, often complicated by pneumonia, and can end fatally, mainly for elderly patients. Treat symptomatically, like any other SARS, fighting with complications. There is no sense in general diagnostics. The management tactics do not depend on it. For prevention, avoid places with a large crowd of people, try not to travel to countries with a high risk of an epidemic, and observe personal hygiene. At the first sign of SARS, stay at home so as not to infect others. If you live with someone, wear a mask at home and ventilate the room. If you are in a serious condition and have shortness of breath, call a doctor immediately.